Private notice question on Covid-19 commemorations. Baroness Morgan of Cotes.
My Lords, I beg leave to ask a question of which I have given private notice. The question is as follows, and I draw attention to my role as Chair of the UK Commission on Covid Commemoration, to ask His Majesty's Government what plans they have to commemorate the Covid-19 pandemic.
My Lords, I'm pleased that today the Government has published its response to the UK Commission on Covid Commemoration, setting out plans to mark this period in our nation's history. I'd like to thank the Noble Baroness and all of the Commissioners for the careful consideration they have given to their report, as well as the Covid-19 bereaved family groups, Covid-19 bereaved families for Justice Cymru, Covid-19 bereaved families for Justice UK, Covid-19 Families Scotland, Covid-19 Families UK, the Friends of the Wall, the Memory Stones of Love, Yellow Hearts to Remember. We're grateful for their involvement in developing this commemorative programme and their tireless voluntary efforts to support others in their grief. I'd also like to thank DCMS officials for their work on this issue. Through this programme of commemoration, we will ensure that those we lost are honoured, that we remember the sacrifices and the resilience of so many, and that as a country we do not forget.
Noble Lady Minister very much indeed for her comments. I would like to thank the Government for their considered and thoughtful response published today. The Noble Lady, the Minister, but also her predecessors, both in this administration and the last. I would like to thank the Cabinet Office and DCMS officials who have been outstanding throughout this process, as well as my fellow Commissioners, and also those who gave us evidence, including the key workers who gave us evidence about their public service. But above all, as the Noble Lady has said, I would like to thank those bereaved families who shared their perspectives on what it was like to lose a loved one in the course of the Covid-19 pandemic. Many of them are here in Parliament today. They were generous in their time and commitment in the public consultation events. And I remember two comments that really struck me. The first was somebody saying, during the pandemic, everyone lost something. But secondly was their determination both to honour their loved ones, but also to learn the lessons of the pandemic for the future. So perhaps I could just ask the Noble Lady, the Minister, just to set out in a little more detail because many of us have not had a chance to read the considered and thoughtful response, how the Government has struck the balance between both commemoration, remembering the loss and the loved ones, but also in relation to future preparedness for a future natural hazard or other pandemic.
The Government is clear that the impact of Covid-19 should never be forgotten, and I'd like to echo the Noble Lady's words about that she quoted the evidence given to the Commission in terms of everybody losing something, but quite clearly for 250,000 people they lost their lives, and that leaves a huge tragic legacy for those that left behind. And I think we want them to be central to the Covid commemoration programme. So we're continuing to support the UK-wide Covid-19 Day of Reflection that will take place each March, and we are going to confirm the dates for the next 3 years. We're working with Forestry England and NHS charities together on the creation of new Covid-19 commemorative green spaces across England's forests and in the grounds of NHS sites. And we are setting out our support for the long-term preservation of the National Covid Memorial Wall, which is obviously just across the river from Parliament where we're sitting today, as a national memorial to the lives lost to Covid-19. And to do that, we're going to continue to work closely with Friends of the Wall, but also with a range of other partners we need to include in that work. In relation to prevention of future natural hazards, including pandemics, we're launching a new UK-wide fellowship scheme on national hazards to support future national resilience as recommended by the Commission, and I'm pleased to say that the first cohort will start next year in February 2026. Alongside this, we're launching new web pages on gov.uk specifically dedicated to Covid commemoration, which will include education materials, a repository of oral histories and a map highlighting over 100 memorials that already exist to allow the public to easily find this information. I do have a lot more information, but I'm clear other people may want to come in to ask questions.
My Lords, can I add my words and my sentiments and those of my benches to remember all those who sadly lost their lives, but also to pay tribute to the workers, not just in the health and care services, but who delivered public sector and delivered many of our public services while many were able to stay at home and shield. My Lords, we recently had a debate on bereavement and how some people who lost loved ones during COVID, while we want to commemorate those who did fantastic work and kept this country going, there are still some who have not yet found closure. And we had a very interesting debate, I think, a few months ago on this same issue. Could I ask, is there any update in terms of what the government is doing to help those who still haven't found closure as a result of bereavement and loss that they suffered of loved ones during the pandemic?
The Noble Lord raises a really important point, and I think a number of Noble Lords will be aware that I had the privilege to work on the response in London, and people who I was working with at the same time as they were leading that response also lost loved ones. So, for example, when I went to the wall a couple of weeks ago, I did look for the heart remembering Diana Walker, who was the mother of the woman who was my researcher during that dreadful period. So I think it's really important to recognise that actually for some people, how do you get over a loss of that kind? And I think that we are aiming to work with a range of organisations, including bereavement organisations, to make sure we get it right. But I think we need to get it right so that we commemorate what happened, but also that as a government we recognise that for so many people the pandemic and the devastating impact it had on people's lives is still very much part of their present.
From these benches, could we also send our remembrance to all those who had died and their families, and also our thanks to so many people across the country who went beyond the call of duty to keep people safe, keep people alive, and to keep the country running during the pandemic. Clearly this Commission and the report talks about preparedness. Could I ask one specific issue? What extra help and provision will be made to local public health departments across the country? Because they're the ones who have the data, have the resources of shoes on the ground, and actually can make a big difference in such problems to do with pandemic or local emergencies.
So I'm happy to meet the Noble Lord in with regard to this at a national level, and I appreciate the Noble Lord was asking about sort of public health officials at a local level. At national level, we've been conducting a national exercise on pandemic preparedness exercise, Pegasus. Clearly, a huge amount is delivered at a local level, but I'm happy to ensure that I set up a meeting for the Noble Lord, either with myself or with the relevant officials, so that you get that sort of level of detail that unfortunately I don't have before me today.
Will Lady the Minister say what the government's plans are for the World Health Organization's pandemic convention, which is moving ahead all too slowly in the United Nations machinery? Would she say whether the government has its firm objective that that convention should be agreed and signed up to in 2026?
I will write to the Noble Lord on the important point he makes.
This appalling pandemic killed thousands and thousands of people, and I'm sure everybody in this chamber knows people who were killed, often a very nasty and unpleasant death. But since then, the Prime Minister at the time, Boris Johnson, has said, as I understand it, and I'll be willing to be corrected, that he thought that lockdowns did not really achieve very much. So I wonder if the Minister could tell us, are the government looking at what the lockdowns achieved? After all, thousands and thousands of people died during lockdowns. Could you tell us what the lockdowns achieved and what the government is looking at in future?
So I think it's really important that we recognise that there's a whole inquiry and whole inquiry machinery that's looking at exactly what the effectiveness of particular measures were. I understand the next module publication is going to be within the next couple of weeks. The work we're announcing the response to today is around commemoration. From a personal perspective, though, I would like to remind Noble Lords that the NHS was in a very perilous state at the point at which we did go into lockdown, and from somebody who was working on the response, the question wasn't whether we should do that, but when.
My Lords, can I add my condolences but also my prayers to those who lost somebody during COVID, particularly those in the chamber today, but also to recognise the hard work of the Noble Baroness Morgan and the Commission. I wonder whether I could ask the Noble Baroness, the Minister, what efforts is being made to ongoing engagement with communities to rebuild the trust in public services, including the health service that was lost during COVID.
I'd like to thank the Right Reverend Prelate for the leadership she showed within London during the pandemic. I think the rebuilding of trust is clearly important, and I think that that's potentially for a wider conversation. I'm happy to meet the Right Reverend Prelate to talk through this. For me, though, I think that in the commemoration and how we're approaching the commemoration, we're really keen to make sure that the heart of what we're announcing today is a recognition of the loss of nearly 250,000 lives.
Offer the Green Group's sympathies, deep sympathies also to those who continue to have to live under the shadow of COVID bereavement, those who are suffering continuing from long COVID, and of course those who gave so much during the pandemic. The Noble Lady the Minister has referred to the issue of preparedness. Now the next pandemic, what WHO calls disease X, there's a high probability it will be a flu virus. It will almost certainly be an airborne pathogen. Is the government ready in terms of medical supplies, up-to-date medical supplies now and in the future to deal with that? And also, what's the government doing in terms of issues of ventilation and air filtration to make sure that we can have safe public spaces in that environment?
Ensuring the UK is prepared for a future pandemic is absolutely a top priority for the government, and we are embedding lessons from the Covid-19 pandemic, including the inquiries recommendations within our pandemic preparedness. And I think, like other Noble Lords, we're hugely grateful to Noble Lady Baroness Hallett and her team for their important work. Just to reassure the Noble Lady, the UK government has been conducting a national exercise on pandemic preparedness, which is exploring a lot of these issues, which is called Exercise Pegasus, and which is involving both ministers from across the UK government, but also working very closely with devolved governments to try and ensure that we do have the preparedness that we need for a future pandemic. We're very clear that this won't necessarily be another 100 years, and we need to be prepared now. It was the first of its kind in nearly a decade, and the largest simulation, so the exercise is the first of its kind in nearly a decade and the largest simulation of a pandemic in UK history. The findings of the exercise and the post-exercise report were delivered in due course, and I'm sure will be of interest to your Lordship's House.
Labour. Following on from the Noble Lady's question and the Noble Minister's answer, can I first of all add my condolences to those that have been expressed by Noble Lords. As regards preparations, the Noble Lady the Minister said that these are underway. They needn't necessarily wait in the detail for the inquiry results. I'm reminded, however, that such an exercise in preparation was carried out in 2016, and it apparently had absolutely no effect after that exercise was concluded and the lessons were drawn. Can the noble lady the Minister assure me that any preparations and any exercises this time will be translated into operational capabilities so that the best memorial and legacy that we can give for those who suffered during COVID and their families is to ensure that if this ever happens again, which is not preventable, that at least we will be prepared and action will be based on the experiences of the exercises we've carried out.
Yeah. Ensuring the UK is prepared for a future pandemic is an absolute top priority for this government, and we're already embedding lessons from the Covid-19 pandemic within our pandemic preparedness, and I've already mentioned exercise Pegasus, so I won't go through that again. But the DHSE has committed to publish a new pandemic preparedness strategy which will set out how the health and care system is implementing the principles of its new strategic approach to pandemic preparedness. And we owe it to every single person who lost their lives or who lost their loved ones to make sure we absolutely learn from the COVID-19 pandemic and get it right for the future.
My Lords, before we move on to the next business, I wanted to make a brief statement of how we will handle the committee stage of the Terminally Ill Adults Bill tomorrow. I'll also send this statement out by email to all members shortly. I understand colleagues are keen to prepare, so hopefully this will help in planning. This in line how business would usually move forward. First, I would like to thank the staff of the